First of all, thank you everybody for having me. I've been looking forward to this. I'll tell you that I do have the chance to tell my story every once in a while, but in a forum like this, and for the reason that we're telling it here today, I'm really grateful for the honor. Bottom line is what was most frustrating for me was the fact that I was a lawyer before this happened. I was involved in medical related litigation. I did a lot of courtroom work, cross-examining doctors, nurses, hospital administrators. I never had a problem speaking up for myself or speaking my mind. I knew the best way to get to the hospital and get the best care was to call 911, and I did that. I lived in a decent area and I knew it was a good hospital. I wasn't scared or afraid about going to that particular hospital. But when I arrived, it was clear to me that the people who were there that day working in the emergency room had other things on their mind. It was a casual environment. It was Mother's Day, it was a holiday, and it just appeared like anybody that got stuck with that shift had other things that they were thinking about doing and they didn't want to be there. I found out later that they had names like moonlighters and things like that, but at the time you don't know. So I would tell you and everybody on this call that I became a frozen victim. I was a knowledgeable person. I was not meek or humble. I spoke up for myself and I had friends and family there that were all trying to do the same thing. Unfortunately, it wasn't enough, and that was real frustrating. I went into the hospital with a headache that got progressively worse, and I'd never gone to the hospital with a headache before, and that's one thing that I always like to bring up is if you trust your body, you need to convince other people that you are what you're feeling or they're not going to pay attention to you. But I went in with the headache that kept getting worse, progressively worse over the matter of a couple of hours. I had labs that were drawn. The labs came back. Nobody read the labs. There were shift changes, handoffs. The labs revealed that I was going into sepsis shock. I probably entered the hospital pre-septic. I became septic while I was there. It was all the cause of an underlying bacterial meningitis, meningococcal meningitis, which there is a recognized antibiotic that is specifically targeted for it. And it stops the progression of the disease. And that's what happened to me over the course of about 8 hours, or after arriving at about 4 or 5 in the afternoon. By midnight, when finally everybody realized what was going on, that's when they finally paid attention and dropped me off in the intensive care unit. Well, let me say that I think that question is answered best in two parts. We got to go back to 2004 when this happened, because I don't know that advocacy was a thing. It was in a lot of people's minds. I discovered advocacy around 2010. But how I believe an advocate could have helped me can be answered like this. And it's very, very specific, I think, to what happened to me. I had a condition. It wasn't like cancer, where if something isn't done overnight, you have a few weeks, you got a couple of months to get, treatment underway or any other type of condition. My condition was a fast advancing systemic infection caused by an undiagnosed bacteria where hours mattered and minutes mattered. So in my particular case, I needed somebody that was going to be able to wake up everybody in the emergency room and get them to pay attention to me. I think if I would have had that, somebody would have looked at the labs and everything else would have fallen into place, and I would have gotten the antibiotic, and my limbs, all 4 of them, would have been saved. I can't guarantee that advocacy is going to be able to help people in every situation, but that's not the point. The point is that there are people out there, all different types of advocates, that have all different kinds of experience that can help in all different kinds of scenarios. So that's why I have to answer that question for me. In my case, I think it definitely would have made a difference. I can't see how it couldn't have when time is so important and the remedy is so easily identifiable if you just pay attention. So I have an extreme case, but the goal of my mission, the goal of GNA is to wake up the nation that these sorts of things are possible. And it's better to have somebody in a room who knows their way around and knows what they're talking about than having me, who had a big mouth, who was able to communicate, but I didn't work in a hospital. I had my friends and my family with me there, 7, 8 relatives. They were good at getting nervous and looking on the internet and making phone calls, and but they didn't know the magic words to use or who to talk to or who to ask if the labs came back and what they showed. So I think it would have made a big difference for me. Let me say that my decision to switch over from defending insurance companies to actually representing victims of medical error was an obvious one for me. I had a lot of litigation experience. I knew a lot of medical malpractice lawyers, so I knew I would have the support. I had a great story. I was very appealing to the people that would be calling me because not only was I a lawyer, I was also somebody that was a victim, but I was also somebody that had gone through the entire litigation process. And I held myself out that way, and my phone started ringing off the hook. And it rang off the hook with phone calls from patients and families that had some of the most frustrating, inconceivable experiences with the medical profession and the medical community, from rude doctors to lost files to delayed treatment to people getting prescribed the wrong medications. The problem is, and I shouldn't say it's a problem, I think it's a problem from if your business model is medical malpractice, those aren't medical malpractice cases. And even if they are, they're not the kind of medical malpractice cases that a good enough medical malpractice lawyer is going to spend 5 or 6 years and tens of thousands of dollars prosecuting to go into debt and cause their client to go into debt if they ever get to a jury. But these calls kept coming in. I started asking around all the other medical malpractice lawyers I know, what do you do when everybody calls with these horrific medical problems, but there's no way that they can help you? The issue is they don't know who else to call. They figure if there's a medical problem, you call a lawyer. That's why I said earlier, we can't go back to 2004 and talk about this, because this profession didn't exist. So that's what kind of opened my eyes up to the fact that maybe the medical malpractice route wasn't the best way for me to go about helping people and changing the system. So I start looking around and I find out that I'm not the only one. There are people like you. There are people who are all over the country that are at this point in time calling themselves all kinds of different things, from healthcare advocates to healthcare advocacy consultants to patient navigators to case managers to care navigators, personal health advocates, private advocates, health advisors, aging life care professionals, geriatric care managers, RN patient advocates. That's just to name a few. But the bottom line is, all of these people were doing the same sort of work, calling themselves similar sorts of names. I got involved in every single one of these organizations, or as many of them that would let me in. I joined boards and stayed on the boards for as long as they would let me stay on. But after serving on the boards and being a part of so many groups and organizations, you start to understand that there are so many qualified people out there that can help in so many different ways. There are all different kinds of advocates out there. There are some advocates that specialize in just resolving insurance billing disputes and helping people get treatments approved. Others are really good because they have a clinical background and then they could actually, read an EKG, for example. Not that they should be or interfering in an emergency room or anything, but at least they could look at it and give some advice. So I decided that, and it was it became clear that all these people all over the place trying to do great things, calling themselves different names, the word wasn't really getting out to the public, who has no idea still. They're still calling the lawyers. They're still calling medical malpractice lawyers, even though patient advocates are out there. Nobody knows about them. So I identified all the good work that these other organizations were doing. There are organizations that train advocates, help them get their businesses up and running. There are organizations now that actually certify advocates, and I saw that my role and where I fit in and where I felt like I wasn't going to be infringing on anybody else, but at the same time I was going to be elevating the entire industry, is kind of using my story and what happened to me to build a national network, pulling in advocates of all types, all shapes and sizes, all areas of expertise from all over the country, and presenting these people in a way that the public can understand, so that they don't have to search for a lawyer or rely on, a family member who's might be in over their head, even if they have a background in medicine. So Greater Chicago Advocates grew and grew and grew. We put on a couple of conferences and seminars that were well received and well attended. And I decided that there was no reason at all not to try and take this thing nationally and provide a way for patients and loved ones all over the country to connect with a patient advocate when they need one, when they're in that most vulnerable situation imaginable. I wouldn't have done it if I didn't know that there weren't thousands of people all over the country that are already doing this sort of work. But I will tell you that I think that just as there's a huge problem in terms of patients and families not knowing that patient advocates exist, I think we've got an equally big problem in that there are so many patient advocates out there that for whatever reason haven't made their skills available. And I'm not talking about the patient advocates that are on this call and the patient advocates that are listed on the directories. I'm talking about patient advocates that don't know that they're patient advocates. Family caregivers, for example, that have been taking care of loved ones, maybe more than one, for 5, 6, 7 years, until unfortunately there might not be anybody else to take care of. And during that time, you know what they've done? They've dealt with Medicare. They've dealt with Medicaid. They've dealt with transitions. They've seen how things get messed up. They've dealt with prescription errors and prescription mistakes and fighting for insurance for durable medical equipment and challenging bills. And guess what? You can go to all the school in the world and get all the degrees in the world, but it's these real world experiences that I'm looking for. The people that have the skills that can help people in their most desperate times. Well, the first step is to encourage every single patient advocate, every single BCPA, every single case manager, every geriatric care manager, everybody, whatever they call themselves, who is in the business of improving patient outcomes, needs to be listed on Greater National Advocates. I can't imagine why in the middle of a pandemic there's any reason not to be listed on Greater National Advocates. Since day one, we've been promoting tele-advocacy to try and encourage patients and loved ones who can't leave the house to actually get on the phone. We have some very, very big things on the horizon. We're the recipient of a substantial grant from the Google Corporation that gives us an incredible amount of bandwidth and reach. We've produced a national advertising campaign that is geared toward our target audience. And we're drawing a lot of attention to patient advocacy. But I'm holding off right now a little bit because I'm concerned that if we release this commercial advertisement that we have it's going to have an impact, and it is going to achieve our goal, or at least start to wake up the nation about the life-saving benefits of healthcare advocacy. And it's going to get people calling. I need to cover the entire nation very, very well. We talked about underserved areas a little bit in the pregame here. It's very, very important to me that if somebody needs an advocate in Little Rock, Arkansas, that the closest advocate is in Chattanooga, Tennessee, even though that's probably not even that far, and it's a bad example. But you know, I'm not saying that the advocates aren't able to help from across the country. They are. Most of them are. But you know, a local touch and a local dialect goes a long way in a lot of these underserved areas. So my goal is to wake up the nation. We're well on our way. You know, we launched in March of this year. We've got hundreds of advocates listed all over the place already. But we need the support of the advocates out there who, for whatever reason, have just held out a little bit. But our mission is to encourage the advocates who have been reluctant to join, who don't have the means or the ability to fork out a handful of thousands of dollars to get their website up and running and worry about how they're going to promote themselves. We're trying to make it easy, and we're trying to remove that barrier from the advocates. Bradley@gnanow.org. So the letter L, no period, Bradley @gnanow.org.
And any final words before we close up for tonight?
No, I mean, I really appreciate this. Happy to be here. I'm happy to see all these people. Happy that I've gotten the platform. I'm just a happy man right now. So.